health secretary also revealed that the British jab may even offer better protection from catching the disease after new data was published. The figures, taken from a Public Health England, PHE, were calculated by comparing people who had received a first dose of the jab with others of a similar age who had not got their vaccine. Addressing the nation at a Downing Street press conference, Mr. Hancock said the data was extremely good news. He said that a single shot of either the Oxford/AstraZeneca vaccine or of the Pfizer vaccine works against severe infection among the over 70s with a more than 80% reduction in hospitalizations. In fact, the detailed data show that the protection that you get from catching COVID 35 days after a first jab is even slightly better for the Oxford jab than for Pfizer, albeit both results are clearly very strong. Professor Jonathan Van Tam this evening explained the dataset and said, "The data shows that if we are patient, then the vaccine program will take us into a very different world in the next less than 10 COVID patients over 80 are being sent to ICU each day." The health secretary said, "These results may help to explain why the number of COVID admissions to intensive care units among people over 80 in the UK have dropped to single figures in the last couple of weeks, which is something I know that we all." The results from the PHE study comes just over a month after French President Emmanuel Macron said the vaccines were quasi-ineffective on people older than 65. Some say those 60. Mr. Hancock this evening said he hoped people right around the world studied the data and understood what is. He added, "Getting the AstraZeneca jab and Pfizer jab could save your life. Researchers say the Oxford/AstraZeneca jab is more effective than Pfizer's vaccine at stopping people from becoming severely ill and needing to be hospitalized. It represents another huge boost to Britain's world-beating vaccine rollout, which has now achieved over 20 million first injections of either the Oxford/AstraZeneca or Pfizer/BioNTech. Nearly 800,000 people have also received a second dose." Urging people to have their second doses, Professor Van Tam added, "I think there is quite a significant likelihood that a second dose of vaccine is going to mature your immune response, possibly make it broader and almost certainly make it longer than it would otherwise be in relation to a first dose only." That meant it was absolutely critical that second doses are still part of the course of immunization against COVID-19 and no less important for that reason. The study also helps to explain why the numbers being hospitalized are falling so rapidly in the oldest age group. The preprint study states that since January, protection against symptomatic COVID for 4 weeks after the first dose is between 57 and 61% for Pfizer and 60 to 73% for the Oxford/Astra's. Deaths among the over 75s have dropped by 40%, while the number of over 85s being admitted to intensive care units with COVID has dropped close to zero. The results were taken from more than 7.5 million people aged 70 and over in England. On top of the protection against symptomatic disease, patients who had just one Pfizer dose had an additional 43% lower risk of emergency hospital admission and an additional 51% lower risk. Looking at the Oxford jab, and people who had been vaccinated with one dose of the vaccine had an additional 37% lower risk of emergency hospital admission. While there is currently insufficient follow-up data to assess the impact, the author said that both vaccines show similar effects, adding, "Combined with the effect against symptomatic disease, this indicates that a single dose of either vaccine is approximately 80% effective at preventing hospitalization and a single dose of Pfizer is 85% effective at preventing death with COVID-19. Dr. Mary Ramsey, PHE head of immunization, said that the evidence adds to growing evidence showing that vaccines are working to reduce infections. She said, "While there remains much more data to follow, this is encouraging and we are increasingly confident that vaccines are making a real." It is important to remember that protection is not complete and we don't yet know how much these vaccines will reduce the risk of you passing COVID-19 on to others. Even if you have been vaccinated, it is really important that you continue to act like you have the virus. Practice good hand hygiene. Figures on the success of both jabs available in the UK follow a separate study by Edinburgh University, published last week, which found that the Pfizer and Oxford/AstraZeneca vaccines were shown to reduce the risk of hospitalization from COVID-19 by up to 85% and 94%, respectively. Phase 1 of the ambitious COVID rollout of first doses, covering 32 million Brits either aged 50 and over and those at high risk, should be completed by April. Ambitious rollout Phase 2 will start with those aged 40 to 49 being offered protection, then all those aged 30 and 39 before the 18 to 29-year-olds. The Joint Committee on Vaccination and Immunization has recommended that vaccinations should continue by descending age, not occupy. The JCVI said the approach will provide the greatest benefit in the shortest time. Some 2,500 vaccination centers have been manned by NHS staff, retired nurses and they have been aided by Royal Voluntary Service heroes, including 50,000 from the Sun. Mr. Hancock this weekend said, "The jabs army marches on. They are doing an amazing. I'm very grateful to everybody who has given up time. Brits, include those who have already received their jab, have been urged to continue following the Sun says stunning protection for old people thanks to just one shot of the Oxford or Pfizer COVID jabs has made muppets of the fake news peddlers on the. It was always absurd to claim a vaccine would work fine up to the age of 64, but be used. We now know a single dose provides 80% protection against hospitalization for over 70. For political gain, Germany and France rubbished our jabs and our strategy of rapidly doing millions of first shot. Their idiocy will cost countless EU lives.